Good evening, Sri Lanka. Health is wealth, and as we begin year 2022 and look forward to a brand new year, things have changed over the last couple of years with regards to COVID-19 or the coronavirus, the pandemic that's taken control, and we look at life in a totally different way. Health has become that much more paramount. People look forward to everything in life with health at its center. So today we're going to talk about osteoporosis at within this half an hour, and probably move on to what it is all about and what kind of controls or restrictions that it has brought into human life, especially here in Sri Lanka, because a lot of people are ignorant of the fact how deadly it could be if it's not properly treated. So to talk to us about and give us the medical aspects of it, and as to give us a specialist view on this whole topic, we do have with us in the studios Dr. Tharanga Samarasekara, consultant endocrinologist at General Hospital of Kalutara. Good evening to you, doctor.
Good evening, Ishan.
To start off with, doctor, this is something a lot of people has had over the last maybe 2 or 3 decades, but people don't talk about it. It's not a subject people actually want to talk out in public. What is osteoporosis?
In simple terms, Ishan, it's the way the condition, the bones become weak and brittle. So if I have to show you a picture, I think it will be more clear, because the bone is the most dense tissue in our body. It's the hardest tissue. But in this condition, the bones become, having lost their density, becomes more breakable, even with trivial injuries. Like we call them fragility fractures. A fragility fracture is where a person falls from a height less than their own height, and so it's a trivial injury and they break their bones. So osteoporosis is a condition that we see this. And
what we have heard is, doctor, that in certain instances even something like a cough could actually result in break of a bone.
Exactly, Ishan. Even cough and sneeze as a trivial injury. In a Sri Lankan context, taking a three-wheeler ride can break the spine.
So if we look at human body, what are the common areas of the body that's most in line with regards to osteoporosis?
There are 3 areas, the spine, the hip and the wrist. So if I am to show you a picture, this is a hip fracture. As you can see, the neck of the hip, we call it the neck of the femur. This is a long bone. It's one of the commonest sites to get affected. Then you have the vertebra. I think people are familiar with the spinal cord. The vertebra supports the spinal cord, and you get the crush kind of injury. As you can see here, the affected vertebra is like a wedge-shaped structure. So it's due to the force and the lack of bone strength.
So looking at these 3 areas, are there any age groups or certain category of people who are most vulnerable to osteoporosis?
Osteoporosis is a disease of the elderly, but we see it among all the age groups, but it's mainly the women, elderly ladies, who get osteoporosis. But it is also seen in younger females with certain medical conditions, and it can be also seen with older males and younger males with hormone deficiencies, and even with children with special medical conditions.
And doctor, if I may move from that to the importance of talking about it, because as I mentioned, here in Sri Lanka we talk less about things like this, especially when it comes to sicknesses. People are very vulnerable to talk about things like this in public. How important is for us to actually educate the general public about osteoporosis?
When a person gets an osteoporotic fracture, it affects the person, the family, the society, as well as the country as a whole. So for the person, let's say it's an elderly lady who's looking after her grandchildren, and while the parents are away, so if she develops a hip fracture, suddenly now she is bed bound. So the parents now have to look after their kids as well as this elderly parent. So this is a significant burden on the person as well, because now she is dependent on the others to get the food, even the basic daily activities like going to toilet, because she is bed bound. So someone has to provide for her. And let's say this person is also enjoying gardening. Now she gets a vertebral fracture, she won't be able to do gardening some ladies are looking after their husbands, sick spouses, so they won't be able to look after the family members. So it's a huge impact on the person as well as the family. And for the country, as let's say, if when the person develops a fracture, it's a huge burden on the health sector, because this cost the inpatient a longer duration of hospital stay. And for the surgeries, they are quite expensive. These implants, they have to be imported from other countries. So especially for a country like us, we are providing it free of charge in the government sector. So it's a significant burden on the health budget.
So if you look at the economic aspect of it as well, as you mentioned, it costs a lot for one surgery. So what causes osteoporosis for people to actually, because as you mentioned, a lot of people in the elderly age group do get caught to osteoporosis, but what causes it?
So it's an interesting question, what causes osteoporosis? So first I have to show you that no one is immune, even the queen is gets osteoporosis. It's due to aging. So bone is not a solid, it's not a dead structure. Some people think it's like wood or stone, but bone is a quite active structure. So every day there is new bone forming and there's removal of the old bones. So we call this bone turnover. So as we age, during the younger days, there is new bone formation more than the old bone removal. So the bone mass increases with our younger as we age. But when we hit our 30s, that's where we achieve our peak bone mass. Thereafter, it's the downfall. So then there is increased bone takeout, that is old bone is removed more than the formation of the new bone. So with this aging, our peak bone density decreases. So this is the cause of osteoporosis. And when the bone loses its strength, it is more viable to more vulnerable to fractures.
And doctor, so you mentioned the peak age is about 30-35 usually. So you are looking at a downward trend afterwards. So what do people need to do? Is there anything that they need to look after themselves in, maybe taking a particular type of food? Is there anything of that sort?
Yes, so bones depend on minerals. So calcium and vitamin D is the most important mineral ingredients for the bone formation. Apart from that, having a healthy balanced diet is also important, and having regular exercise is also important. When you talk about exercise, there are like 3 types of exercises that we do. One is the weight bearing exercises, which helps to strengthen and model the bones. Then we do the cardio, that will help the bones as well as the muscles, which supports our body function. Then we do balance training like yoga, which is also important in prevention of falls.
So is there any particular method of following these 3 types of exercises, or should someone in the age of, let's say for instance 50 or 60 do more yoga or do more cardio? Is there anything of that sort that we need to look at?
Yeah. So interesting question. So in the younger days, you should be more focusing on the weight training as the muscle strengthening exercises. But as you get older, you should, I'm not saying that we should totally ignore weight training, but you should be more aiming more towards the balance training to prevent falls from happening.
So what we have looked at is about what we need to do to try and prevent. But as you mentioned, doctor, earlier, women are more prone to osteoporosis than men. Is there a particular reason for this?
Yes. So in average, males are having higher body weight than the females, and testosterone is a component that increases the bone mineral density. So as you know that men, as compared to females get menopause. So at the around age of 50, the females stop ovulating, so their estrogen levels go down. So with that, their bone mineral density also goes down. But with compared to males, they don't get that kind of a sort of a drop of testosterone as they age. So they tend to have a higher bone mineral density even at the older ages. So that's one of the things. Other than that, men have more muscle mass, so they exercise often. That could also explain that females getting higher incidence of osteoporosis.
So, if you look at that, how do we identify that someone's got this deficiency?
The problem is, Ishan, osteoporosis won't cause any symptoms per se, especially during the early stages. Once a person gets a fracture only, they will realize, okay, that I have osteoporosis, but by that time it's too late because the damage has already been done. So, in the early stages, if there's a screening by investigation, yes, we can pick up people with osteoporosis, but usually the case is once the fracture occurs only we get to know.
Looking at all of that, doctor, because I think this is something Sri Lankans are not very used to, going in for medical checkups regularly and things like that, because it's only when you reach a certain age or when you're retired that you think, okay, I need to go to a doctor and maybe do a medical checkup. How often would you recommend youth to try and maybe go and get themselves checked, a regular checkup? So, we say beyond 40 at least once a year. Is there a medical checkup that
yes, for osteoporosis, I would say you need to start screening at a later age, let's say after 65 for the females, 70 for the males. For the younger persons, I think it's best to stick to the preventive method, that's do exercise, get more activities and stick to a balanced diet.
So, if we pick food, say breakfast, lunch and dinner, is there a particular type of food that we need to take, say carbs or veggies, or is there red meat of that kind of sorts that we need to take in order to prevent ourselves from getting into trouble with osteoporosis?
Yes. So, it's the key message is get a balanced diet. So, in Sri Lanka we eat a lot of carbs and that's why our obesity levels are now getting increased. So, it's better to cut down the carbs and have a good portion of vegetables, at least half of the plate, and leave a quarter for the protein items, that could be meat or fish.
All right. So, what we need to tell the public is that to try and reduce carbs, I think it's not just for osteoporosis, I think it prevents a lot of other diseases
yes.
too, and gives us a healthy lifestyle, and more exercising is what we would recommend
yes.
in order to stay healthy and try and prevent getting yourself into this kind of a situation. But if you do find yourself in a situation where you or your elderly parent has got osteoporosis, is there a particular method of finding out that the bone density is lower or it's lower than what it should be? Because as you said, if once the decline starts, is it periodic or is there more loss of bone density in a human? How do we identify that type of thing?
Yeah. So, there is a test called DEXA scan that we do to identify osteoporosis. It's just a simple X-ray, but we use very much less energy than the conventional X-ray. It's available in government hospitals as well. This is a DEXA machine. So, you can see the patient lies down on the bed and the X-ray is taken. And this is the report we get, and it's a graph that you can see. It categorizes the bone mineral density or the bone strength, and we get a score according to the X-ray parameters. And there's a thing called T-score where we compare the person bone mineral density to a younger healthy adult population bone mineral density. If it is more than a certain value, we call them having osteoporosis and we direct them for getting the treatment.
So, doctor, if we talk about, elaborate on that as to what the numbers are like. So, we talk about body mass indexes and all of that when it comes to healthy diets and healthy lifestyles. So, in this case, if a DEXA scan is done, what are the readings that we usually, what average human being would expect, and how do you identify and what are the number readings should be like?
So, we look at the hip and the vertebrae mainly. Sometimes we look at the wrist as well in certain disease conditions. So, we get this T-score. If it is more than minus 2.5, we categorize them as having osteoporosis either at the spine or at the vertebral level. So, if it is less than minus 1, that means it's normal, and if it is between that minus 1 to 2.5, we call it osteopenia.
So, between 1 to minus 2.5, basically minus 1 to minus 2.5, they are prone to get probably aggravated with age. What do you do when you have this kind of condition?
When we detect that, we try to identify any underlying risk factors. Let's say if the person is taking certain kind of medications like steroids, and then we try to correct that. Then if the patient is having undernutrition, like it's not taking enough calcium or vitamin D, we check the blood levels and we tend to correct it with supplements. And if the patient is not getting enough exercise, we advise on proper balance training, and depending on the age, proper weight training as well. So those are things we do to prevent the condition getting deteriorated. And there's a thing called FRAX score that we do. It's available in the internet as well. When you get the bone mineral density values, we feed them on the this tool, FRAX tool, and we can get a value 10-year risk for the fracture risk. And if the risk is high, then we offer treatment for osteoporosis.
So FRAX score should be around what number?
Depending on the risk factors as well. So depending on the other certain parameters.
So doctor, now we have spoken about certain things with regards to osteoporosis, and you mentioned about 3 key areas in our body. Why is it that hip, the vertebra and the wrist are more prone to have this issue and fractures compared to the other bones in the system?
These areas are the weight bearing areas. Compared to a rib or a jawbone, the vertebra and the hip takes a lot of body weight, and they are the most vulnerable areas for getting a fracture.
So in order to prevent or identify, is there any blood test that could be done or identified?
Yeah, I wish we could have a simple blood test, but unfortunately we don't. But we do blood tests on patients to detect any risk factors, like let's say there are any underlying conditions. There are a lot of hormonal conditions that lead to osteoporosis, like thyroid hormone deficiencies. Then there are sex hormone deficiencies like testosterone deficiency in males and estrogen deficiency in females. And there are certain endocrine conditions. That's my specialty, like Cushing syndrome, where patients are more vulnerable to get this osteoporosis. So we do these tests to identify whether the patient has these conditions. And other than that, we check for vitamin D deficiency, which is quite common in Sri Lanka. Although we have a lot of sun, we stay indoors and we wear long sleeves, so we don't get enough sun. And we also do like full blood count, the basic test, ESR, kidney functions, because sometimes people with problems with the absorption, they have problems in the gut, so they don't get enough nutrients inside the body. Although they have a good diet, they can't get absorbed into the body. So to detect those kind of conditions, we do blood tests. And certain kind of cancers, in multiple myeloma, to detect that also we do blood tests.
So is there any impact in certain medication for other diseases that could result in a side effect of having osteoporosis?
Yes, very important question. Sometimes we give steroids, especially with COVID pandemic, the patients were developing lung problems. So to counteract that, we were giving prednisolone and dexamethasone. They were working like miracle, but the problem is it also affects the bones. If you give steroids for a long term, patient put on weight, their bone mineral density goes down, so develop osteoporosis, plus they can develop diabetes. So it's a double-edged sword, but to save lives, sometimes we have to give. And certain kind of cancers, we give anti-cancer treatment, which lowers the sex hormone levels, like let's say breast cancer depends on estrogen, and some prostate cancer in males depends on testosterone. So we have to artificially lower these hormone values in the body, so that can lead to osteoporosis in the patient. So those and sometimes we give drugs like omeprazole for gastritis. So sometimes patients take it over the counter, so that if they take it for a long term, it is known to cause osteoporosis.
So if we elaborate on that fact, because I think gastritis is something a lot of Sri Lankans these days find themselves got in. So if there is a particular medicine, as you mentioned, if you could bite off the shelf or bite off the counter, what is the time frame that you would say is ideal that you should not continue?
Ideally, they should not buy it over the counter, and it's prohibited in Sri Lanka. You can't give it out of prescription, but that's the normal practice, right? So it's best to give for the shortest possible duration. I would say that.
All right. So that's something for everyone to keep in mind as well when it comes to certain medications, that there is a side effect of this sort. So as a final, doctor, before we summarize of all of this, one thing that propped up to me is like a lot of these younger males, when you hit the gym, you tend to take proteins and extra loads of it. Is that good or bad, or will it have an impact on your bone structure or the bone density as you age?
Well, if they bulk themselves up, it will affect positively, but I'm not promoting protein supplements. You should take it according to your needs, exercise needs. Even you take muscle bulking agents like mass protein, whey protein, it won't give positive results unless you don't do exercise properly, right? So it's a matter of having a balance. So it's good to take supplements if you properly, if you are doing weight training, but the more without doing exercise, if you take proteins, it won't give any beneficial results.
Right. So what we see is, so to summarize of what we have spoken about on today's episode, is that osteoporosis is something that we need to talk about, educate the public about, and at least once you reach your retirement age, to try and regularly go check yourselves out. How often do you think, Doctor, you mentioned 65, 70, say our retirement age is around 55 or 60, where do they need to go to? Can they go to a normal base hospital or a clinic and get themselves checked, or where do they need to go and get themselves checked properly?
We have DEXA scans in major hospitals like teaching hospitals, so it's best if you suspect that you are having osteoporosis, talk to your family doctor or the general practitioner or the OPD doctor, then they will guide you to the correct center if there's a real indication.
All right, so that's a little bit of what we spoke today about osteoporosis and the importance of knowing what to do. And if you do have this situation of if you or your family members, maybe your elderly parents, are down with osteoporosis, it does have an impact on the whole livelihood, your family, how you manage all of that. If you have small kids at home, to look after them and an elderly parent and all of that, as doctor mentioned, has economic bearing as well. So that's to try and stay away and try and prevent from getting into trouble. I would like to thank Dr. Tharanga for sharing expertise with us on today's edition of iMed. We will talk more about osteoporosis when we meet doctor next week. So until then, it's bye-bye from me.